You're watching CTOM TV. Knowledge is power.
Okay, and Tegan is wondering, if I have ovarian cancer in one ovary, should I get both removed?
That's an excellent question.
You're liking the
Yes,
questions
I
today.
am. These are great questions. Well, I think we should look at the different terms. You have the partial hysterectomy, which is removal of the uterus. You have the total hysterectomy, which is removal of the uterus and the cervix. And then you have the BSO, bilateral salpingo-oophorectomy.
Okay.
And that is removal of both ovaries and fallopian tubes.
All right.
So, you know, depending on what type of cancer you have, if you're looking at ovarian cancer, there was an excellent study done by our local cancer agency. They have this great program called OVCare in BC, and they have some wonderful, brilliant scientists there that and doctors that have come up with a great plan. And you know, it's unfortunate because they've been getting a lot of resistance with this plan. So what they found out,
from whom?
well, so what we know right now is that the stem cells that cause ovarian cancer originate, well, not in every type of ovarian cancer, I have to be clear, but in certain types of ovarian cancers, the stem cells that cause it originate in the fallopian tubes. So the cancer actually starts in the fallopian tubes.
Okay.
So these doctors at OVCare figured out that if you remove the fallopian tubes with the ovaries, you could greatly reduce the risk of recurrence. And I think in their study, they found, you know, I think it was a, you know, up to 40% reduction in the risk of dying if you took out the fallopian tubes with the ovaries. So very significant.
And now, what's that surgery called?
Or what's it's called a BSO.
BSO.
Yeah. And so, so they've been getting a lot of flack from, you know, different studies and so on, going back and forth on this. I think it's fairly well accepted now that if you have a inherited mutation, such as a BRCA1 or an ATM, something that's going to give you an increased risk of ovarian or breast cancer, then, you know, you want the complete radical surgery that takes everything out.
Which is not the BSO.
No, that's the BSO.
Oh, that is the BSO. Okay. All right.
That's the BSO and a complete hysterectomy.
Okay. All right. So if you have some of those markers or concerns, you would want to just have everything removed, because then it gets all those stem cells.
Exactly. Now, I think from the cases we see, we always recommend people get everything taken out. You just don't want to have to worry about recurrence. I mean, you know, recurrence of a cancer in your ovaries, if you can reduce that, if it's localized, you want to get everything taken out, most definitely. So, you know, there's lots of studies that will show that, you know, getting everything out is important, not just the ovaries. Now, the problem is that, you know, when you have your ovaries removed, you have a greater risk of cardiovascular disease and, you know, lung cancer, stroke, and dementia, and things like that. So it's, you know, it does have some risks, but, you know, definitely that's something that I would, you know, seriously
if you can prevent
consider. Don't leave anything in.
Cancer from,
yeah, just don't leave anything in.
And then there are things you can do for each one of those potential downsides to help.
Yes, you can.
Right.
Yes, of course.
Yeah, like it's not a given that if you have everything removed, you're going to then deal with one of those other issues.
No, exactly. Exactly.
Yes. Yeah. A great question, Tegan.
Yes.
Thank you.
Thank you for watching CTOM TV. Subscribe below and stay informed.